Please welcome Dr. Richard Williams, world-renowned speech pathologist. Now you're here to talk about something serious today, is that right?
Yes, I'm here to talk about my new book on Landau-Kleffner Syndrome, or LKS. LKS is a rare childhood neurological syndrome characterized by seizure activity, or abnormal electrical brain waves, and problems with understanding and producing language. Unfortunately, the cause is unknown.
When do children acquire LKS?
Between the ages of 2 and 12, with the most common ages being between 2 and 7. The seizures usually end by 12 to 15 years of age, but recovery of lost speech and language skills is difficult. In general, the earlier the onset of LKS, the more difficult it will be to regain those skills.
Wow, between 2 and 7. Those are critical ages for language development. Those children didn't have that crucial time to understand, learn, and practice using language during that critical period of language growth. Regaining those speech and language skills is much harder if you didn't get that time to develop them.
Right you are, Oprah. You've done your research.
What can I say? I've been known to Google on occasion.
Good one, Oprah. Typically, before the onset of LKS, children are developing normally. All of a sudden, they lose their ability to understand what is being said to them. They also have difficulty producing speech and language. This process of language loss will range in severity, and it may last from a few months to a few years, depending on the child. Of course, there's a lot of variation in terms of age of onset, characteristics, seizure activity, and behavioral issues.
Regression? Language problems? Sounds like it could be autism.
You know your disorders. True, LKS can be confused with autism, among other disorders like hearing loss and learning disability. However, these children have epileptic seizure activity and have the same desire to communicate as they did before LKS. The important thing to remember is that these children have the sudden loss in the ability to understand and produce language.
I think we'd all like to know a little bit more about these speech and language problems.
The most common characteristic, and usually the first sign of LKS, even before the seizures are identified, is that the child has difficulty understanding what is said to them. Consider going to another country and not speaking their language. Think of how confusing that must be.
So because these children are not understanding or responding to language, this might cause some parents to think that their child is deaf or has a hearing problem, even though they have normal hearing.
Yes, you are correct. Did you also know that these children have difficulty identifying environmental sounds around them, such as a doorbell ringing or a fire alarm sounding? And these comprehension difficulties may persist into adulthood.
That's fascinating. But you also mentioned they have trouble with spoken language?
Yes. Following the severe loss of language comprehension, their spoken language severely starts to deteriorate. These children have difficulty thinking of the word they want to say. They might say the wrong word for something, or they might say a made-up word instead of the word they meant to say. You will also start to see them using incorrect grammar and repeating sounds, words, and phrases.
That would make these children extremely difficult to understand.
Absolutely, Oprah.
Now the world wants to know, is there a specific treatment for LKS?
There are medications to control the seizures, but there is no cure to regain speech and language skills.
What about speech-language therapy? I've heard that word.
Definitely. Speech-language therapy should begin as soon as possible and should focus on strengthening the residual speech and language skills that they have and compensating for what they don't. They may use lots of visual support since these children don't have problems with vision.
What kind of specific techniques are used?
Well, many children and families use gestures, pictures, and color coding. Sign language or using speech while signing is great because it gives them visual and auditory models of language. If the child learned to read and write prior to LKS, written communication is also a possibility.
I bet helping these children communicate makes them feel a lot better.
Absolutely, Oprah. With children with LKS, you might see some behavior issues because it is so hard for them to understand what is said to them and to communicate back. They might feel frustrated and isolated. In some cases, you see oppositional, aggressive, or withdrawal behaviors.
Bottom line, we need to help them communicate. Where can I get more information about LKS?
For more information about LKS, please visit the following websites.